Welcome, everyone, and thank you for joining us today for the sixth installment of the Prevalence Reduction Innovation Forum Learning Series. I am Dr. Lidia Letraris, coordinator of the Prevalence Reduction Innovation Forum, or PRIF. Today's webinar will feature a presentation on the PRIF study on forced labor and the brick-kiln industry in Sindh province, Pakistan. As usual, we will have a Q&A session, a question and answer session after the main presentation. So please use the Q&A box. That's the box with a little question mark to place your questions, and our presenters will address them after their presentation. I will now turn it over to Dr. David Okech, our director of the PRIF.
Thank you so much, Dr. Letraris, and good morning, good afternoon, good evening, whatever time it is for you. And what a great honor. This group has gone through a lot. I think it's one of the most resilient research groups that we've had in PRIF based on what they've gone through, the issues there. So I'm so honored today to be able to just listen to the presentation. So today, researchers from Johns Hopkins University and the Aga Khan University conducted a study to assess the prevalence of forced labor in the brick-kiln industry in Sindh province of Pakistan. The research team utilized two sampling methodologies: multi-stage cluster random sampling with probability proportion to size, that is PPS, and respondent-driven sampling, also known as RDS. They observed differences in estimates for 3 of 7 PRIF human trafficking domains, with higher estimates produced by RDS than by PPS. They will also highlight how the August-September 2022 floods on the brick-kiln industry impacted the study, as well as their humanitarian response and the working and living conditions of the workers. Welcome, Dr. Cortland Robinson and team.
Thank you very much, David and Lydia, and greetings all. Good evening, good afternoon, good morning, good whatever. I'm going to turn this over shortly to my colleagues, but I'm Cortland Robinson at Johns Hopkins Bloomberg School of Public Health. But I'll be turning over to colleagues also from Johns Hopkins, Mandoor Rizvi, and then Zafar Fatmi, who's the PI for Aga Khan University, and then time permitting, hear from one of our colleagues, Asya Arif from Society for Protection of Rights of the Child, or SPARC. Forgive my scratchy voice. I just tested positive for COVID yesterday, so bear with me, but I won't talk long because this is kind of a group presentation. We have a lot of material to go through. Hopefully we won't go too fast. We want to spend some time and certainly want to get your questions and comments. There's a lot of material here, but some of these are just a few points on a slide. I'm just going to take you through sort of the basic design and methodology, and then Mandoor will sort of walk us through how we responded to a quite catastrophic flooding in Sindh province, and the entire country of Pakistan really was inundated in 2022, and how we use that to assess the situation and do some redesign on our intervention. And we'll talk about the results, PPS versus RDS, some of the qualitative findings, and then take you into some of the ways in which we redesign things, both accommodating floods, but also trying to build in a more robust intervention design and M&E plan. So we'll try to get you through all of those within about roughly 40 minutes of this time for Q&A, and we'll talk a little bit about next steps as we move this thing forward. So I won't go into too much detail, except to say that the issue of bonded labor is a substantial one in Pakistan, in many different parts of the country, including up in KP province, formerly called Northwest Frontier. For a variety of reasons, we chose to focus closer to home in Sindh province, which is near Aga Khan University, also substantial forced labor there, but we felt proximity gave us a lot more access. And so we chose Sindh over KP, and we're not suggesting that one stands for the other, but we believe that many of the findings do apply, at least more generally, to this problem of bonded labor, which involves 4.5 million brick-kiln workers, most of whom have taken some kind of a loan to get into this work, and in doing so often get trapped into forms of debt bondage and labor exploitation. And it takes many forms, as this bullet point at the bottom shows, it particularly impacts internal migrants. We don't have external displaced persons. We did not find Afghan refugees in Sindh, but that can be a thing. Often religious minorities, Hindu, in the context of a Muslim majority. But if you flip the script and went into a predominantly Hindu, I suspect you would find ethnic minorities being exploited there. So these systems of exploitation are ones that we're trying to unpack, both at the individual level as we get into the intervention, at the kiln level, and even at the district level. So we undertook first some community mapping. We did extensive counting, actually, using community key informants to map most of the sites where kilns, all of the site districts where kilns existed. Some districts did not have kilns, so we did not map those, but we get into some of those numbers later. So we really had a pretty solid denominator, right? So we could use that for sampling and other purposes. And then we did exploratory work through key informant interviews and in-depth interviews. We can give you the sample sizes on that shortly. And then we were hit by the floods. And so we had to do a kind of a stand down and rethinking. And we're very pleased to say that our colleagues here at CenHTRO enabled us to not only do that work, but to put in about $10,000 in direct assistance. So we're very grateful for that. And that both helped relieve some of the burden of the floods, but also sort of build community rapport. Spark already had an excellent relationship, as did Aga Khan, but this helped even more so to say, we're here, we want to help. We're not just here to study things and run off and publish papers in obscure journals. We want to see that the work that we do with you is translated into something meaningfully in the way of positive outcomes. Finally, in January 2023, we could get into the quantitative survey where we used a quota sampling in about 8 selected districts in Sindh and applied 2 different sampling methodologies, multi-stage cluster random sampling with probability proportional to size. That's a mouthful. We just say PPS. And respondent-driven sampling, RDS. We used NSUM. We won't get into the results there. That's another conversation, but we will share you the results. Somewhat surprising in a way. We were a bit surprised by how these 2 samples performed. Still not exactly sure why the differences occurred, but there were some interesting ones, and my colleagues up our Fatme will talk you through that. I'll finish with this slide and then hand over to Manur. But the qualitative research pre-floods, I've made some of these points earlier. Many of the kilns are in isolated areas. You set up your kiln where the soil is, and that isn't usually in the middle of a city. So you're out in rural areas, often unregulated work, very little or not much mechanization, lots of sort of hierarchical structure, which can lead to domination by a supervisor or a higher up. Characteristics of the workers are they're often landless minorities. They live on site, and we found in other studies, one in Thailand, that if you live in the place where you work, if your residence is owned by the owner, that leads to further exploitation because there's really no way out. Your entire life is dictated by sort of where you live and who owns your buildings. And you're often deprived of government services, even when there is supposed to be access. So the drivers of debt are manifold. I won't get into all of them, but it's quite clear from the qualitative, and I think the quantitative bears this out a lot, that as people take out loans for things like illnesses or marriages or just other life experiences, they end up deeper and deeper into debt. They get trapped in this phenomenon that is called debt bondage or bonded labor in the context of Pakistan, or what we might call forced labor. And with many health implications: transmission disease, poor sanitation, lack of access to clean water, often sexual violence, physical violence, and limited access to proper healthcare services, and poor enforcement of existing laws, and often, sadly, even corruption and collusion, where it's not simply the laws are not enforced, it's the people who are sometimes tasked with enforcing the laws are deliberately avoiding doing so and taking money to continue the exploitation of workers. So many things that we were trying to look at, and the interventions we hope will address at least a number of these, perhaps not all. But I'll stop talking here, turn things over to Manur, and then I'll sort of pick back up when we get into sort of final comments about next steps and discussion. Thank you very much. Manur, go ahead.
All right. Thank you, Dr. Copeland. Hi, everyone. So I will be presenting the impact of floods on the brick-kiln industry and the workers. Pakistan experienced one of the most devastating monsoon seasons in 2022, leading to catastrophic floods that impacted over 33 million people. There were about more than 1,000 deaths, including 550 children. More than 6.4 million people were in immediate need of humanitarian aid, including about 650,000 pregnant women and 3.4 million children. Although this is not the first time floods have caused like a national humanitarian emergency in Pakistan, as there were unprecedented floods back in 2010 as well. However, climate scientists concluded that climate change accentuated the impacts of the flood, making these super floods. So basically, the southern provinces of Balochistan and Sindh were mostly affected. Over 56% of the population within Sindh province, where our study was basically located in, was affected and displaced. There were serious problems that they had to face, especially the brick-kiln industry, given that they are like as Dr. Copeland mentioned, that brick-kilns are usually located in remote areas. So brick-kiln workers were greatly affected by this. Next slide, please. So as you can see, this is like a screenshot of the impact of the floods in all of the 8 districts that were where our study was basically conducted. You can see that the displaced population was far greater in some of the districts, including Mirpur Khas and Sangar district, where the rains were much more intense. There was loss of agriculture, loss of livestock. Relief camps were set up by the government and other organizations as well. And brick-kiln workers were able to get support from there. However, some of these camps were really located in remote locations. So people did face, limited access to humanitarian services that were set up by the government itself. Next slide, please. As you can see, these are some of the pictures that were taken by our field teams from Al Khan University and Spark as well. People had to sort of, set up camps alongside roads, close to the brick-kilns that were affected by the floods and had like a lot of flood waters that were submerged in the flood waters. The devastation and the damages were far greater. Next slide, please. So our team collectively decided that because of the floods, we had to halt all our program activities. And in light of the devastating floods, like Dr. Copeland mentioned earlier, UGA, allocated an additional $10,000 for immediate flood relief to brick-kiln communities in our targeted settings. The funds were basically utilized to conduct medical camps, which were in all 8 districts of our implementation districts. And these were conducted by Al Khan universities, and food baskets were distributed to about 200 families that were most vulnerable in all 8 implementation districts by Spark. Moving on. Next slide, please. So with encouragement from both UGA and GTIP, we were able to modify our study design by incorporating a supplemental qualitative research component, which basically included 48 in-depth interviews with brick-kiln workers and 24 key format interviews with local disaster management authorities, service providers, and brick-kiln owners. Spark also conducted some damage assessments. These included like very thorough field visits to all of the brick-kilns that were damaged and far-flung areas, basically, just to assess what kind of support could be provided and what kind of changes were needed within the study design. Next slide, please. In addition, we also were able to develop a 30-question flood impact module, which was incorporated within the quantitative component, the sample size for which was about 800 interviews per methodology. And Dr. Zafar is going to talk about the results shortly. So we were able to include this flood impact module in all of the interviews that were conducted during the quantitative research. And then next slide, please. I will go over some of the results from our qualitative research. And basically, the flood basically caused significant loss of livelihood. As I mentioned, there was serious displacement, suffering due to loss of assets, identification documents as well. There was floods also created some food insecurity. People were not able to, especially brick-kiln workers, were not able to access humanitarian services. We also saw that there were, extended closure of brick-kilns following the floods, which basically resulted in that debt accumulation for most of the brick-kiln workers in this province. As basically most of the brick-kilns within Sindh are located within the 8 implementation districts of our study. So most of this population really also depends on agricultural work. That's the alternative income that they turn to during monsoon seasons. But because of the super floods, they were unable to even do that work. So they had to take loans from their owners, which owners provided, and the brick-kiln workers were very thankful for that. However, that really accumulated their debt. Also because of the floods, their health expenditure and out-of-pocket payments also increased, by a much greater extent as per usual. So from our qualitative research, we were also able to find out that the most common diseases were like fever, cold, skin diseases were rampant, and then there were symptoms of gastritis and waterborne diseases as well. But a lot of the respondents also, mentioned that they were basically injured during the floods because of damage to the infrastructure, to the kilns, or their homes, or these camps where they basically stay at the site. So there was severe damage to that, and because of the floods, they also, and the remote location of the kilns, they were unable to actually access healthcare services in a timely manner, and because of that, there were some loss of life as well. And other than that, so again, like I mentioned, that the extended closure of the brick-kilns became an issue as well. The damage in terms of infrastructure for the brick-kiln owners became a problem. However, after about 4 to 5 months, things started normalizing. We still see some effects of the flood when you visit some of these kilns in Sindh province. However, people were able to go back to work. Now I will hand over to Dr. Zafar to go over the results from the quantitative research.
Thank you, Manor. Zafar, are you online? I can't see you on my screen, so hopefully you're here and ready to launch into our presentation.
Good evening from Pakistan. So I opened my camera. I hope people can see me. As you can see, we did a lot of formative work before we started this baseline quantitative survey. We had no record, or very patchy record about how many brick-kilns are there in the province of Sindh itself. So there were variable records which shows from 1,000 to 5,000 to 10,000, so estimated. So Ministry of Labor and others had no clue. So we did, as you saw in the initial, we did community mapping ourselves, and we estimated that about 2,000 plus brick-kilns across 23 districts in Sindh. The 7 districts are in the city of Karachi, which had no kilns. So the rest of the 23 districts had about 2,000 plus kilns. Of those 23 districts, we surveyed in 8 districts, and we utilized 2 methods. One was multi-stage cluster random sampling with probability proportional size, and I'll talk about the respondent-driven sampling in the next slide also. So in the PPS surveys, I'll call from here. Sorry, go back.
Sorry.
So in
I heard you say next slide. Sorry.
Yeah, so next slide I'll describe. Yeah. So of the 23 districts, we selected purposely 8 districts where we thought, and we had an estimate about 45% of the kilns were concentrated in these because these were the large kilns based on the population. So there were 630 plus kilns were there. And of those, we actually, randomly selected 80 kilns based on population sizes, which you can see on the right side of the table. So we had the brick-kiln workers population in the districts. Based on that, we, proportionately selected the number of kilns from each of the districts, 8 districts we selected. And at each kilns which were selected, we actually sampled 10 households as a quota sample. And those 10 households were later weighted in the post sample in order to, if they were large kilns, for example, or a smaller kiln, for example. So it was weighted to make it equal for the prevalence study. And from one, each household, one member was selected, one male, one female alternatively, so that we had equal number of female and males at the end. So this, if you look at the right side, so like, the education, female education and universal health coverage index and proportion of household belonging to poorest and poor and middle. So those are the, kind of statistics given, which are coming from the national surveys. And you can see on the very last column in particular, which is important, that most of these people, the brick-kiln workers, belong to the poorest or the poor, or some of them from the middle income group, based on the wealth quintile of the national survey. Next slide, please. Yeah, so the other method we use is the respondent-driven sampling. On the same kilns and population and the districts where we were doing this PPS survey. And we, in each of the district, we use 2 seats, one male and one female, because there's hardly any, for cultural reason, there hardly any interaction in that sense, that male can, interact with other families, female for that matter. So that's why we had one male, one female, again, identified purposely per districts. And there were 8 districts, as I said. And 3 coupons were distributed to each male and female member initially. And as we realized later, after a while, that, there were a lot of, participation, and the response rate was good. So we reduced it to 2 because there were too many people coming. So it was a peer referral process, and the waves continues till we achieve the target in that particular district. And generally we had like average of 7, maximum of 7, and average of 6 waves. The RDS network graph is shown here, and you may not be realized, but the make it, but the red ones are the ones with, who have some, the forced labor with at least, threshold 3. So those are actually mapped here. And those were the black ones are, the other group, which doesn't have the forced labor, prevalence. So that's just a kind of depiction of the map, shows that how much of a prevalence we got through RDS network. Next slide, please. So this is the comparison of the 2 sample as a demographic. If you can see, over 90% responded and no formal education, which was equal in both the RDS and the PPS sample. And both were similar. Most of them were poorest and poor in our sample as well, based on the wealth quintile of national wealth quintile. So that just validated our, estimate. And they were similar on most demographic characteristics, except if you see the 2 things. One is the married rate. So 90% of the RDS samples were married, and about 80% of the PPS samples were married. So that was the one difference. And the other difference is the second last row, if you look at that, living outside of the kiln area, those in the RDS sample were about 24%, and those who were living on site were 6%. Outside were 6%. And that may be because of the method we employed. Obviously, when we were doing PPS, we were going on the kiln at the site. And that's why those living outside were just 6% comparatively to the other method where we were actually giving coupons. So probably we had, more wider network explored through RDS sample. That's one inference we can draw. Next slide, please. So RDS estimates, if we look at through threshold 1, threshold 2, and whether they met either or both of the threshold, so RDS estimates were higher in all of these, almost, from 12 to 25. It's almost double, if you can see that. So, for example, recruitment into forced labor, about 18% in RDS versus just about 4.5% or 4.4% in PPS. Employment practices and penalties, 28.4 versus 7.6. Violence and threats of violence, 14.2 versus 4.9. So big difference. So there was, though, no evidence of difference in estimates produced by the two sampling method for PRIF domains of personal life and property, freedom of movement, and debt or dependency. So other things were similar, except for some of the other, these three. So reports of degrading conditions were like common and universal, I would say. So that's why there wasn't any difference on that. Next slide, please. So what are the implications of these results? So prevalence of forced labor was common among brick-kiln workers. And if we say in PPS, we found lesser prevalence compared to the RDS, but between 17 to 34% meeting at least one PRIF threshold. And estimates were typically higher in RDS. The lower estimated prevalence of forced labor in PPS. And now we can, discuss that as PPS, why the prevalence was low. It may suggest that the location of the interview may be a key factor, because there may be a fear of, giving the information at the site. Maybe the social desirability or reporting bias might be there. But also there is a sampling, as I said, a wider network, on-site people versus other people in RDS sample. That might be another reason. Well, there's much more to learn about, estimating. It is important to, consider that what else can be measured alongside prevalence of forced labor. I mean, we did measure many other things in this, which I'm not pressing, like mental health measures. We add some occupational health and safety measures also, even respiratory health also. So those are some measures we, measured. Okay, this is not for me. So, so based on this information, qualitative, quantitative, all of that, and the mapping exercise, and so we did substantive, formative inquiry before we started developing our intervention. So, we changed the study design from panel survey and so sampling at baseline and endline to open cohort, because there is a lot of movement and in this population, we realize from the formative phase. So, and also we thought that if we want to determine the impact, for example, so it has to be a longitudinal design, following them up for over time, because if we do the cross-sectional thing, so obviously that will not be helpful in determining what changes the intervention are bringing. So incorporating more focus on occupational health is, and while this whole intervention had been a lot of discussion between different stakeholders, Spark team, as well as on ground other stakeholders, as what is the best intervention we can develop. And there were some which were very could have been very serious. Kind of critical, and could have, for example, taking legal actions or providing legal support. So those are the options we have discussed over time, but we came up with some of the interventions which I'm going to describe in the next slide. So we designed this intervention, and we are just in the initial phase of recruiting the cohort. We haven't started properly, but we have just started at 1 or 2 sites. And the purpose is obviously to reduce prevalence of forced labor among the brick-kiln workers with the interventions we found. With the interventions we have discussed and found that those may be effective through the qualitative and quantitative inquiry. So the overall, obviously, and the project aims to build an open cohort of 2,000 intervention workers and about 800 control workers. And we have a design where there'll be 4 districts, which will be considered as an intervention, considered for intervention, and there'll be 2 separate districts will be considered as a control. And it will be a 2-year intervention. We will do a baseline. We are doing a baseline. We'll do a midline after 1 year, and then an end line at 2 years, completion of 2 years of intervention. And as these skills are situated in clusters at a specific location within the districts, so we are taking clusters of kilns, and we have 7 clusters in 6 districts. So there'll be, as I said, 4 districts for intervention. There'll be 5 intervention clusters. There's only 1 district, will be 2 clusters instead of 1, which is where we have a lot more kilns. And there'll be 2 districts where there'll be 2 clusters. So in all, we'll have like 6 districts and 7 clusters. And in each cluster, there'll be 5 kilns. And so a total of 35 kilns, and 25 will be intervention, and 10 will serve as a controls. So that's the design we have. Next slide. So what are the interventions? And that's where, it's very important to understand. So there are some district level intervention, there's some kiln level intervention, and there's some individual and family level intervention. So we thought that, there are policies and regulations on which some measures can be taken. There are already laws and regulations and the committees like district vigilance committees and legal aid service units, which have been established. They may not be actively working. They should be supported in a manner that they become more active and do the work they're required to do, and make them and strengthen them. So that is one thing we thought would be very important. In this also, I'll talk about also that, the legal, legal action was also discussed, but we had several back and forth discussion, and then finally thought that would be too critical because it may jeopardize all the other interventions, and that may be, subtly taken into, consideration through the committees, the administrative channel, and we as a university or as Spark as a partner, not directly involved in the legal battle in this scenario, because otherwise it might be, might backfire. But in addition, we are doing kiln level intervention as you know that these population gets affected and got affected by the floods, and there was a clear need where we thought that they require clean drinking water and they require more water. So that intervention we thought would be a good rapport building to start the work as well as there is a clear need for the population which might improve the overall health of the community. So we are providing hand pumps to each of the kilns both intervention as well as the control areas and individual water filters to each of the households so that they have clean drinking water. That's the first kind of intervention, but it is both for the intervention and control areas. But the other interventions, the district level, the kiln level, and the individual levels are done only like the 4 districts where the interventions are done, and the 2 districts, there's no intervention being done. The kiln level intervention is very important, is the social employee social security institution registration of the worker as a formal worker. So once they are registered with Ministry of Labor and the SESI, then they are recognized as a formal worker, then they get benefit of the health and other social services. So, and before that, they don't have the computerized national ID. Several of them, because of the marginalized population, because they don't have required documents, they don't have the national identity card, which is required for all the other health services and other services which are needed. So they need the national ID card. So we thought that at individual level, we'll provide the CNIC, computerized national identity card, and through Ministry of Labor registration, they would also get the SESI card for health and social services. And for the children, this is B form, which is the birth registration certificate. It's the same as the CNIC for under 18 children. So there are other interventions like non-formal education. Obviously, 90% of them do not understand what accounting, how to do the accounting, for example, for their debt. So we realized that they should have some understanding of the debt they are incurring while working. So so that's some accounting and some education, non-formal education for adults as well as children. And then there were clearly occupational safety hazards, the heat, the dust, and the injuries, which 3 things which we realized was very common. They work in extreme heat and they work in a lot of dust. So we thought of giving health education besides providing some personal protective equipment. And of course, heat also, some intervention as rest stations and water availability, as I said already. So in addition, there is a direct services intervention. And this is kind of still we have been discussing, but direct services is like some support and for their health needs. And at the moment, we thought that if anyone gets severe occupational injury, and that's the definition, so they will get transportation costs, emergency support for getting some, getting to some health outlet so that they get health support. So that's the direct services we are also providing, because these are population. Also, most of this debt are incurred because of their health needs, and they spend a lot of money on that. So we thought that this might be also be a relieving factor. So next slide. Yeah, so Coach, here you want to start?
I can jump in, and maybe Asya as well. I mean, this is really beginning to open up for just general discussion, but we'll just very quickly. We've begun enrollment, as Zafar said. I can't remember the exact number, 500 or so workers, maybe in 3 clusters. And we've had to stop again because of the rain. So we're the kilns for 2 months, or at least sort of sometimes partial closing. We want to continue some qualitative research and begin to finalize all of the other implementation activities. Not begin to finalize, we're finalizing them. And expect to be fully engaged on all sites, all activities by around October, inshallah, as we say. So we'll then do a midline a year after that, approximately. We're trying not to do these surveys in the middle of the rain, so we're going to have to sort of avoid monsoon weather. We've learned our lesson now twice, and I have to sort of figure that out. But essentially, the idea is do midline after about a year, take a measure of intervention outcomes versus controls. Are there changes, or the things that we want to learn about, and maybe tweak some of the intervention activities so that we can carry that forward into the second year. And then we do, that's midline around 2025, and then end line in 2026, where we look at both quantitative and qualitative data, comparing outcomes for workers who have the intervention activities and the controls who don't have those, but everyone does get the water pumps and water filters. So we're hoping to measure general effects of access to water that would not be an intervention measure. It would be all populations, but there may be ways in which the different groups have different uses for them. And then after that, of course, we begin to finalize our analysis, write up reports, and share with key stakeholders and audiences in Pakistan and beyond. So that kind of ends the formal presentation. Thank you for listening, but I want to see if my colleague Asia Arif from Spark might want to just comment a bit on the intervention and the implementation and some of the hopes that you might have for what the outcomes that we wish to achieve, expect is a strong word, but certainly hope to achieve, how we might see those results translate into policy change, program change, and at least advocacy with evidence.
Yeah, thank you very much to all the organizers, AKU, GHU, and those at and the organizers here. Yeah, so regarding Dr. Coates' last point, policy is something which is very close to Spark's heart, because we have been involved into policy when it comes on child rights, and bonded labor is one of the core areas where Spark has been working for the last 30-35 years or so, for many decades. So for us, it is our very first experience of translating research into intervention, and for us it is also a learning experience along with AKU and JHU, and what we wish to achieve from it, what are the outcomes. Of course, the foremost would be more ownership by the government, that is by SESI, Sindh employee, which is meant to benefit the employees which are into bonded labor sector. So first and foremost, we are looking forward to have ownership of the government. And then, of course, any sector that can jump in, which is private sector and other sectors. And given, like already mentioned by Dr. Zafar and fellow colleagues, implementation of all activities would start by October 2024. So as time passes and as all interventions unfold, hopefully we'll be able to see some change on ground. Whereas when it comes to policy level, of course, working with bureaucracy has its own challenges, but Spark is on it, and hopefully we'll be able to come up with at least stirring up the movement and bringing more attention into the issue of bonded labor as it is currently in Pakistan. Yeah, thank you.
Thank you very much. I'm going to stop sharing just because maybe it's better to look at faces but we can go back. I hope nobody's going to have a quick question on a slide, but we can call those back up if we need to. But just thank you again to the organizers and of course the UGA for all their support over the years. It's faced many delays, we've faced many challenges, and all of the things that usually happen, sort of IRB issues and contractual issues and that sort of thing, plus floods, plus now kiln closures due to the rains. They've been challenging, but we're ready to go. We think we're prepared to go. The good news is the kiln owners are saying, when are you going to get started? So that's not great news in the sense that they've been waiting and saying, you know, you keep studying things. Now, when are you going to actually act? But the good news is they're keen to see this happen. Now, whether that changes over time, if they begin to see that not only are there improvements in health and possibly improvements in literacy and that sort of thing, but also maybe rise in labor complaints and disputes that have to be taken up at DVC or the district vigilance committees and the rest, and they say, hey, there's problems being surfaced that maybe we don't want people talking about. That could happen, and of course we have to deal with that both as an ethical issue in terms of conduct of human subjects research, but also as a very real matter of protecting people from possible pushback. But that's sort of where we think Spark's expertise comes in, because this is the work they do. So we bring the health, we bring the measurement, and Spark brings some of the advocacy and whether it's gentle or sometimes not so gentle arm twisting to say to people, hey, there's the right thing to do and there's the wrong thing to do. And we're here to try to help you see that the right thing to do is good for you too. So I'll stop there and see if there's any other comments or questions. Thank you to our organizers. Thank you to all my colleagues who have been doing this hard work. We've got more work to be done, but we're really eager to see this finally getting to full implementation and see what the results bear out over the next few years.
I just wanted to make a very quick comment. So first of all is to congratulate this team for actually being not just researchers, but being human. I think when there's a flood, your response was research aside. We first want to care for the people. So that was quite interesting because sometimes we researchers are not that selfless. So I really want to highlight that and to congratulate you. But a second comment is about, the whole philosophy and science beyond prevalence research, right? So I think there's one of the slides that you say that, that we need to ask more questions beyond prevalence. And I couldn't agree more. The whole idea of prevalence is basically to give us some baseline data. But, the questions that you asked about, health issues, living conditions and challenges, all that should be part of a prevalence study. So I was joking with a friend that if you look at some of our prevalence reports, which are 200 pages, the prevalence part is only like 5 pages, right? Then the other pages speak about, the living conditions, the challenges, sociodemographics and, health issues, mental health issues, like for Johns Hopkins, I think it was very important to focus on health as an entry to that particular population. So I really want to agree with you that, when we're doing these prevalence studies, the idea is not just to give us an estimate. The idea should be to give us like a very holistic understanding and all the nuances about the drivers, facilitators, service, policy gaps, everything that is associated with that number. Because when that number is in context, then we can do what we are just about to do with ASEA and colleagues, which is intervention. The number alone cannot inform intervention in the best way, but all those other factors actually can help us inform these interventions. The very last question I had about, I think in one of the interventions you had non-formal education. Do you mind describing that a little bit? Is that basically just numeracy and literary skills? I see that close to 90% of our people here do not have any formal education. So is that basically the ability for them to be able to read and to count, or do you want to say a little bit more about that, please?
So maybe we can take the last question first, and maybe, I don't know, ASEA, if you want to take that on, because SMARC has done extensive work with NFE and mapping this again to existing curricula so that children or adults, as they complete this education, get certified as achieving certain levels of literacy and numeracy so that they can then enter into more formal education. I think that's one underlying thing I would just note, that we're trying very hard to map all of this to what either exists or is listed as on paper as existing, but hasn't yet been sort of fully activated. Not trying to reinvent the wheel or sort of pay for everything out of the project and then it goes away because the money runs out at the end of the project. We want to build into and on top of existing services, and NFE is really just one element of it. But maybe ASEA, if you want to answer, there's many more comments in the and questions, interesting ones in the chat. I hope we can get to all of them. But anyway, and then we can get back to some of the other questions, David, and or get on to some other ones because I know time is not extensive. But ASEA, on NFE, please.
Yeah, on NFE, briefly speaking, then I would also like Dr. Zafar maybe to respond because he was also a very vital part of this whole process. For the non-formal education, given we are a nation with 22.8 million children out of school and the illiteracy rate in Sindh is very, very high. So, and when it comes to your brick-kiln sector, of course, education has never been a priority in Pakistan. So there was this idea of maybe reaching out to two different target audience through some approach that we would agree upon. Like for adults, there is this numeracy that is ongoing, and of course, when you're taking a certain loan and you're not aware of rate of interest that would be applicable to it, of course, alone would increase manyfold. So that was the main idea behind adult literacy, and plus they should be able to maybe understand what is being written in local language, Sindhi, or maybe in Urdu, or maybe a few words of English. That would help. And for children, of course, NFE is something that Government of Sindh is very keen to work on, and they encourage NGOs to come forward to that. So just as shared by Dr. Courtland, we are not, Spark is really not reinventing the wheel, but rather we are using the same curricula that has been given by Government of Sindh, and we have also engaged certified institutes that have trained our teachers who will be working in brick-kilns. And the first and initial stage was their main code training. And Dr. Zafar, may like to add on a few words on
I
it?
think you described Asya very well. So it's primarily, I mean, the purpose so that all the workers have a register. The owner have a register where they keep the accounting for the debt and how much bricks they have made, and how much earnings they are making every day, for example. And obviously we want them to understand that. So primarily the adult literacy is for that purpose, so they understand the register, they understand those countings. And we have asked that question in the baseline as well, that whether you understand those and whether you do accounting yourself, for example, or not. And those are the questions we have in the baseline. And that we will obviously measure later on as well after the NFE. But in addition, obviously NFE is a whole curriculum to give a more holistic and non-formal education. And for the children, it's kind of a benefit if they're not employed, but their families, children who are there, and some of them are also employed. So they get benefit of this intervention as well simultaneously.
Thank you. I'm just noticing some really excellent questions and interesting questions in the chat, and another in the Q&A. We have only a few minutes left. I would hope that we can capture this. If somebody could share that, a transcript of the questions and maybe email context, because I really would like to follow up. Just one, for example, that some colleagues from Wright Lab at University of Nottingham have done some mapping from space. We've done that too with other studies in Somalia and elsewhere. So there's many ways to map. We chose to sort of get on the ground, do it the old-fashioned way. Be interesting to see how those link up, right? Whether your sort of your data really does actually translate, as you sort of, as they say, ground truth it. Or do we learn some things about things that might have been missed by sort of getting on the ground and talking to community key informants? So much to follow up there. Maybe just, if I may take, I'm not sure I'm moderator, but just whatever preference I might have, a privilege I might have. Kate Cooper asked a really interesting question. Could you share a little bit more about how kiln owners interact with your project? I think that's has multiple sort of layers to it, including things like IRB. They want to know that too. What do you do about getting permission? So we get signed letters of permission when we engage with the kiln owners. We cannot do this behind their backs. This intervention is open. We tell them we won't tell you who we're talking to, but you have to give us permission to do this work on site, or it can't happen. You can't do hidden non-formal education classes. You can't do hidden occupational safety and health trainings. So that's a factor. So in one sense, we may get a bias toward people who are willing to cooperate. That could happen. We may not get much access to the kilns that are saying, we don't want you anywhere near us because we see that you're going to expose the kind of harms that we know perfectly well are going on. There is that, but maybe somebody else could talk about how we interact with kiln owners. Zafar or Asya?
Yeah, so this was the central kind of issue in terms of barrier, as well as how do we deal with them, and whether, so in a sense that, when we did the survey, as we are calling this study as a health and safety study all the time through ethics review and all of that. So, and we are starting this intervention as a health and safety and, overall water and overall support intervention, where we're providing education and everything else. So you see the way we are approaching this. So we are not saying we are going to take legal action against you, or you're doing something wrong directly. So we're approaching so it at some point in time, obviously, and there are legal, as I said, LASU and other forums are available, which are laws are there. And they understand it quite well. So they know it. They actually go through it all the time. So it might happen. I mean, at the moment they're very welcoming, as the court has said. It's kind of some kilns are very open, and some kiln owners are not that open, because probably they may be doing more exploitation, and that's why probably they are not that open. But most of the kilns are quite open because they even showed their registers to us. Once we visited, them, they showed the register, how they keep the accounting and everything. One thing we realized at several of the locations, this is kind of open secret that these people are being exploited. So probably quite a community know that this is not kind of very hidden kind of thing. Maybe sexual exploitation, another severe form of exploitations probably is not known. But the debt exploitation and the loan exploitation, those kind of things probably known to most of the people, police and other stakeholders in that sense. So it's not a hidden thing, and that's why if it's not a hidden thing, so they don't hide it in that manner. So they say, here is a register, that's how we operate, and that's how we give the rates, which is obviously minimal. And it's kind of so that's how we had fear. We still have fear, whether this will backfire at some point in time, and that's why we're approaching very carefully, taking permission, involving them throughout this process, because we can't really do any intervention without them. So we have to involve them, engage them in all sense.
Asya, you want to offer any further comments on that? I'm happy to stay on a bit longer. I know people have other schedules to meet, but happy to stay on. We're after 10 o'clock US time, but these are really very interesting questions. And as I said, we really would like to, I know Manor just answered one of them, but there's others about how do you operationalize, forced labor? We can get a whole conversation going on that. What are your metrics? Again, how do you engage? What do you do? Or do you think you're gonna, one says, do you think your kilns are less likely to have bonded labor or terrible forms of it following the intervention?
Yeah.
We certainly hope so. That remains to be seen, of course. Yes, the study will tell us.
There is one easy answer.
Yeah, go ahead.
So there's one easy answer. I wonder if Pfizer suffer said that, how did you measure what proportion of bonded laborers were entrapped, and are you brick-kiln workers, seasonal migrants? So what was the measure? So I think that we didn't elaborate, but we used the PRIF measure, obviously. Yes. So that is, I think, is important to know, which we are utilizing, and it's available online as well. So you can have a look at that as well. So these had like 12 indicators, and you can modify it and use it, and the details are there online. So, yeah.
I see that some people are going, and that is understandable. I know it's time, but I also know that Colton has said that they're going to stay a little bit. So I think we still have the Zoom. So should we say that maybe we can continue until maybe 10 past, 15 past, but please, I know people are busy. If you feel you need to go, please feel free to go. I know there are questions and also there are responses in the webinar chat to some of the questions, but we don't want to make you feel that you have to stay if you need to go. We understand that. It's a very interesting presentation, so please, if you feel you need to go, please, we'll see you another time. I think on the 12th, that is our last PRIF presentation. But meanwhile, I wonder whether we could continue until maybe the next 7 minutes or 15. Andre, Lydia, how long do we have this? Do we have like time? Do we can?
We do if our panelists would like to stay on, that's
yeah.
fine. We've also taken
Yeah, 10 more minutes.
Sure, and we have a copy of all of the questions that were asked if we don't get to all of them, and the people who asked them, so we can follow up and like send the team that,
Good.
so.
It's an interesting question about climate change. I think the floods, we noted that the super floods were attributed to climate change by quite a number of sort of authorities. This was not a matter of, oh, it just got bad one year and you know it'll sort of regress to the mean. People in Pakistan and around the world were saying these are climate change related effects, and so we tried to sort of bake that into our thinking, not necessarily say how can we address climate change per se, but how can we deal with the reality that ambient temperatures, heat is rising across the planet, and that of course, occupational risk of heat exposure in these kilns is very real, climate change or no. So that's important to us. There was a question that related sort of what kinds of kilns are we seeing? I would defer to Spark or AKU to say exactly how we might capture that, but we will work closely with all of these kilns over 2 years. Spark case managers will meet monthly at least with each worker. AKU will have quarterly monitoring, visit the kilns, talking to workers. We will interview the kiln owners as study participants and other stakeholders. So we are going to be very much present, and that we think is positive. That might lead to sort of, as you say, Hawthorne effects. People want to behave better when they're being observed. That could happen. But we also hope that some of this idea of people sort of care about what happens on the kilns. There's people who want workers to be healthy, who want production to continue, but also without sacrificing safety or, of course, without compromising their rights to safe and dignified and well compensated, fairly compensated labor. So how we look at sort of what kilns do, what sort of work, how mechanization or lack of mechanization plays into these conversations, I think that's something we're very open to talk about. And I think that's one of the things we're intrigued by, sort of as we go forward with this and we learn, what things do we learn that we don't know enough about that we need to learn more about? And that's where you can build in more qualitative work, or possibly maybe tweak some of your interventions and say, maybe the safety issue is not simply about gloves and shoes. Maybe it's something about the kilns themselves. Maybe certain kinds of kilns are seen, at least qualitatively, anecdotally, as safer. Can we help kind of steer the conversation toward that, even if that might include higher costs, because it may include mechanization. So all of these are things that we really would love to focus on. How well we do that, I think, is a matter not just of how much time and resources we have, but also what are the higher priorities. So what cannot be sacrificed in any of this conversation is the focus must be inclusive of a close look at forced labor. If you're improving occupational health, or if you're improving protective equipment, the question we're asking is that correlated, associated in any way with reduced risk of exploitation? So we don't want perfectly healthy and safe workers who are extremely hard pressed by physical and sexual violence and huge debt. That's not a win. That's not a win. We'd like to see if we get win upon win, so that you reduce forced labor and risk of exploitation, and you improve health and safety and dignity of the worker. We think those are possible. We think they're actually conjoined, but that's sort of early days on that conversation.
Yeah, so I was trying to skim through all the questions quickly. And I've noted a few points there. First, there was this, how were we able to identify? So I'll give an overall picture of what is the scenario in Pakistan. So it's a bleak one. I don't want the participants to get discouraged, or maybe the panelists here, but it's a bleak one. We don't fare very well when it comes to Global Slavery Index, and every 10.6 in 1,000 people, they're in modern day slavery. But then it's not only bonded labor, there are multiple other forms of modern slavery, and bonded labor is prevalent mostly in two provinces, that is Punjab and Sindh. And Sindh is an area where it's more, the frequency is very high. So as for the question of climate change is concerned, climate change it's strongly correlated, and when you come across the type of kilns, they are generally the traditional ones with chimneys emanating lots of harmful waste into the air. And of course, time and around, we have brick kilns in Sindh which are shut, especially those near the main roads or near the motorway. So maybe you can get some idea of what is the environmental effect of these brick kilns overall, and its relationship with the climate. So this has been happening more in 2022 and 23. I haven't heard of it as yet in 2024, but with the onset of winters, the issue gets manifold. And because of the hazards that these brick kilns are causing to the environment, of course, it also leads to road blockages and traffic issues as well. And as for, there was a query whether all were in bondage when the teams went there, the research teams went there, or maybe the intervention team went there. Basically, bonded labor cannot be overruled when it comes to when you're heading to a brick kiln. And of course, that needs rapport building. And with the passage of time, the participants or the beneficiaries, they would be sharing their situation more comfortably. So bonded labor is there. The prevalence is very high. Government in Sindh, it acknowledges the prevalence, but of course, more serious efforts are needed to be done. And for that, civil society and research institutes like AKU and JHU, they have joined hands here. So these were the few questions that I was able to go through. And if any further query is left, maybe you can share and we can.
Just on the climate thing, and those are not directly, obviously, be addressing through this study, but as we, as academic institution, obviously, the students get interested in these kind of, particularly the heat thing, for example. So heat among agriculture workers, heat exposure among the brick-kiln workers, and heat exposure among the, indoor workers. So how do they compare, for example? So those are the questions being answered as separate small studies, which are not directly linked, but as we, going through, so students, master students, which are working at Aga Khan University, are trying to answer that. One of the things we realized, and that's another study we did, that, at the kiln, the temperature usually 5 to 7 degrees higher because of the heat itself of the kiln, as well as the heat, heat absorption by the brick itself. So it's kind of heat island, a small heat island kind of thing. So that's another thing we want to, again, it's a simple study, obviously, just looking at what's the peripheral temperature versus what's the, central temperature. Those are kind of side studies. Students will take it up, so those are, but not directly, obviously, we addressing through this. We might, over the years, have some sense of how these occupational health is impacted by the climate, their productivity in particular, or their health in particular. So those are the questions we, obviously one is flood, which is we are directly trying to measure for the climate, and that is, so when the flood comes, and if like in 2022, the kiln was closed for more months, they incur more debt, because they were out of business, they were incurring debt more and longer. That we knew through our qualitative inquiry. So those are kind of things we know that they are linked with climate, and so those are in mind. Yeah.
I'm just noticing the chat. I'm glad that our smart colleague Zahid Tebo has responded to Bart on the question of zigzag kilns versus trench kilns. Again, we're more than happy to be in further conversation with any and all of you to talk more about our study, hear what you're doing either in Pakistan on brick kilns or just more generally, and just see how we can collaborate. I think UGA has just been a wonderful partner and supporter in all this is serve as a kind of a forum, right? This is the Prevalence Reduction Innovation Forum and as a platform for doing this kind of work together. I was down at UGA was it last year, and I cited a hero of mine, Paul Farmer, was a great human rights advocate as well as an extraordinary physician and public health practitioner. But he offered the phrase, "Do hard things with friends." It's a hard thing we're trying to do. We're trying to alleviate some risk of forced labor and some risk of occupational safety and health in an environment that doesn't generally privilege workers. It privileges profit. That's a real thing. That's just not true in Pakistan alone. It's true all over the world. So we're doing a hard thing, but we're doing it with friends. And UGA is a friend, and we're so proud and pleased to have Spark and AKU as colleagues of Johns Hopkins. We hope they're as happy to have us around. Sometimes we can just get difficult questions about contracts and IRBs, but we all try to make this work in the end. But again, thank you. And we're more than happy to field additional comments and questions and just stay engaged with this because it's an important problem we're trying to tackle here. And we will have more answers, we hope positive answers over the next few years. But I suspect we'll also learn more about even challenges that we don't know enough about now to even describe. And then try to sort through how to tackle those as we go forward.
Okay, so I bet that's me, Lydia, right? Is that me now? Yeah. I'm telling you, yeah, Cortland was here on October 4th last year, and he said, "Do hard things and do that with friends." Of course, it's a quotation from somebody else. And I've been saying that everywhere I go, do hard things and do it with friends.
Don't quote me, it's Paul Farmer. Anyway, thank you.
I know. And I can tell you, this team has really been one of the most resilient teams, like at PRIF, the approach. And also, I really like that you continue to emphasize, the well-being, just to show that you're truly public health people, the well-being of the workers. So I really want to applaud that as well. Your approach is so holistic, and I'm looking forward actually to seeing the results of this experiment that you're doing. Hopefully we see something that we can learn from, all of us. And there's something that is very similar to our work in Senegal, whereby it's about 140 degrees sometimes in the gold mining sector. And so I just wrote that down, how does it affect the miners and even the sex workers who are there? Sometimes it's close to 145 degrees there. And that is not because, of the heating in the kilns. It's just the temperature close to the Sahel of Africa. So thank you so much, everybody. And also, we can't forget one friend. The UGA, of course, is a friend, but also the Department of State has been a great friend. The Office to Monitor and Combat Trafficking in Persons, can see Natasha is here, and maybe some people are here, some have left. But the US Department of State has been a great friend, actually, in these efforts to measurably reduce the prevalence of trafficking across the world. Thank you so much for attending. Yes. We will see you on August the 12th for our last PRIF series. And then after that, please look forward for a special issue on this project. Thank you so much and have a good rest of the week. Bye.
Thank you.
Thanks everyone.
Bye-bye.
Thank you so much, everyone.